My name is Althea Hayton, and I am going to tell you about what is actually there in the dream of the womb. The dream of the womb is a real prenatal story. It is constantly reenacted in born life until it is fully understood. We all have a dream of the womb, and the womb twin survivor has a particularly interesting story to tell about prenatal life because for them there was a twin there. So a lost twin in the dream. There are 3 twin pregnancies that may occur. One is the fraternal twin pregnancy, the dizygotic or 2-egg twins. The second is identical twins, monozygotic or 1-egg twins. And the third is multiple, which can be any combination of the above. So let's take a look at some of these forms of twinning. Let's say there's a complete pair of dizygotic twins. They both develop in quite separate little spaces. If we have a pair of monozygotic MZ twins, how things work out in terms of the pregnancy depends upon when the zygote split. So if the zygote splits completely into 2 morulae, you get a side-by-side kind of identical twinning. If they split apart really early, from the 1st to the 4th day, just like fraternal twins, they have their own placenta, their own amniotic sac. And if you look at them on ultrasound, it's very difficult to tell whether these are identical or fraternal twins. The second type of monozygotic twinning is if they actually develop together, that is to say they have the same placenta. So you get a blastocyst forming, you have 2 little inner cell masses forming within the blastocyst, but you get a twin pregnancy with 1 placenta but 2 little sacs. That's if the split happens between 5 and 8 days. If the split happens a little later than that, you also get the single placenta, but the cell mass inside the placenta divides a little bit later so that there are not 2 amniotic sacs but only 1. These are known as momo twins because they're monozygotic and monoamniotic. They have 1 amnion, 1 amniotic sac. Of course, you can have a multiple conception. You can have triplets. Here is a trizygotic triplet pregnancy with 3 separate eggs, and they have 3 little sacs and 3 little placentas. A very common multiple conception is to have 1 identical pair plus another, a pair and a spare. So you have 1 pair of monozygotic twins in a shared chorion, and you have another embryo. So what signs might there be that there was a lost twin? Well, there are signs during pregnancy, at birth, and within the body of the survivor. During pregnancy, well, one of the main ones is that the uterus is extra large in the first trimester. This young mother-to-be is only 12 weeks pregnant, but she's already wearing maternity clothes. Another very important and very common sign is bleeding in the first trimester. Various articles have been published that seem to agree that about 20% of pregnant women do experience bleeding in the first trimester, and this is a sign of a vanished twin, which suggests that vanishing twin pregnancy is very common indeed, and that seems to be what research is beginning to show. You might have an attempted abortion, but the pregnancy continues. You might have a miscarriage, but the pregnancy continues. The stronger alpha twin is the womb twin survivor, and the weaker beta womb twin dies. You might have an ultrasound scan which shows the vanishing twin, a little sac somewhere alongside with a little embryo that just isn't getting anywhere. When you go back a few weeks later, there's no sign at all of that second sac. Everything's disappeared. The twin has vanished from the ultrasound screen. Or if you were conceived as a result of in vitro fertilization, the chances are you are a womb twin survivor because several embryos are usually transferred after in vitro fertilization. And taking hormones to stimulate ovulation as part of artificial reproductive technology, that greatly increases the possibility of a multiple conception. And if too many babies are conceived, you might have a reduction. You might have a reduction of a multi-fetal pregnancy down to one. In this case, the triplet pregnancy is reduced to a single birth, and 2 fetuses or more are selected for lethal injection. So what sign might there be at birth that there was a twin? Of course, one twin may quite simply be stillborn or be dead within a week or so of birth. This is commonest among identical twins. 1 in 10 identical twins will be delivered before 32 weeks, that is to say, prematurely. And prematurity, as we know, is connected with neonatal death. Then you have the wonderful fetus papyraceous, which is just the mummified, flattened body of the beta twin, which has died. And it's more than 12 weeks of development, so there's a little skeleton there, so it's not going to vanish and be reabsorbed. It's still there and can be seen at birth, like this image here. You might have extra cords or sacs attached to the placenta at birth. Here is a twin placenta showing the 2 very strong cords. Usually where one of the twins has died, it's a much smaller affair, just a little almost invisible sac and cord. And sometimes 2 or more sacs or cords are seen attached to the placenta when it is delivered. The 2 placentas, your placenta and the twin placenta, may fuse together so that when there is your placenta all nice and big and red, but attached to it is another little placenta, which is all that's left of the twin that was once there. Placentas can sometimes have extra lobes or be thicker. These are also signs that there's been a twin pregnancy. So what signs might there be within the body of the survivor? Well, a very dramatic example of this is the fetus in fetu, where the twin is enclosed in the body of the surviving twin and continues to try and develop. But this man, who had his fetus in fetu removed, became a womb twin survivor after his operation. The parasitic twin. This is a form of conjoined twin, but the body of the twin is not complete. It might be a third nipple, extra fingers or toes, an extension to your spine, or entire limbs or a head that belong to your twin. And here is a 17th century image of a man with a parasitic twin attached to his tummy. He didn't have recourse to surgery, so he was forced to carry the body of his twin around for the whole of his life. A teratoma is like a slightly more organised dermoid cyst. You can usually see specific tissues like bone or teeth or hair or fat within the teratoma. A dermoid cyst, which is a totally undifferentiated mass of fatty tissue and hair and sometimes teeth. These cysts have grown from embryonic cells from a lost twin, which have become embedded in the body of the survivor, very often found on the ovary or underneath the skin. A chimera, that's where 2 embryos fuse and become one, so you literally are 2 people at once. You see the 2 zygotes here, and they become 1 embryo together, and then the person, as they develop, has both cell lines within their body. Cerebral palsy has been connected to being a womb twin survivor. It is much higher than normal among womb twin survivors. Signs of the opposite sex. This is very fascinating because you have some people who are some women who are very manly and some men who are quite feminized. Like the women have facial hair or a very strong muscular body, and they have a deep voice and so forth. And in men they have sparse facial hair, rounded physique and a much higher voice. And this might well be because of a missing twin of the opposite sex who left just a little bit of additional opposite sex hormone behind when they died. There are some other signs as well: left-handedness, mixed-handedness or ambidextrousness as they call it. Dyslexia might well be connected. Twins in the family seem to be connected, and having an imaginary friend. All this needs more research to be absolutely sure about, but they do seem to be very closely connected to being a womb twin survivor.